Good afternoon, everyone. Happy Sunday. We are happy to have you all back for our annual Greek Sisterhood Forum. Typically, we have a luncheon in person, but obviously, with all of the COVID kind of cases rising and all of the logistics, we decided to continue it virtually this year, and hopefully, we'll be able to go back in person next year. So on behalf of our committee, we want to welcome you all and thank you guys for signing up. So good afternoon, sorors and sister sorors. Happy Sunday and welcome. My name is Jakari Henderson, and I serve as the president of the Gamma Kappa Omega chapter of Alpha Kappa Alpha Sorority Incorporated. Today is a special day because we celebrate you and all the greatness that you all embody. Sisterhood has brought us here together today, but our divine womanhood is what keeps us going. Today, we embark on a discussion that many of us stray away from. We are mothers, sisters, aunts, wives, leaders, downright barrier breakers, and the glue that holds our families together. However, in leading in all of these areas, our lives, we sometimes become our last priority. So today we celebrate and educate you about taking care of yourselves, making yourselves a priority while you're working on being the best version of yourself for those around you. We ask you to stop and consider yourself. We are worthy of being selfish with our time, our thoughts, and efforts, whether it's taking time to go for a walk, a bubble bath, a spa day, or just turning off your electronics to get a sense of peace for the day. I know many of you all have been triggered the last few days watching our sister Ketanji Brown Jackson being criticized, ridiculed, and disrespected, a feeling that many of us experience too much in corporate America, in the classroom and in the boardrooms. However, in the midst, my sisters, through the tears we saw, our good sis pushed through and was resilient in the face of adversity, scrutiny, and disrespect. And let's not forget, she was the most qualified in the room. It can all sometimes be overwhelming and break us down. Today, my sisters, we acknowledge all of your sacrifices, your insecurities, weaknesses, and strengths, because we get it done through it all. We encourage you to take care of yourselves. You are the strength, love, sisterhood, and service. We welcome you, my sisters, and we celebrate the phenomenal women that you all are. Our committee hopes you enjoy this special day that we have planned for you, and we thank you all for attending. I'm going to turn it over to Tangela Oliver, who will bring our prayer for today.
Hello, everybody, and welcome. My name is Tangela Oliver. I am the president of the Mu Eta Zeta chapter in Carbondale, Illinois, of Zeta Phi Beta Sorority Incorporated. And we thank you for taking time out of your busy schedule to join us today. And I will just start us off with prayer. Father, today we come to you with thanksgiving in our hearts. We thank you, Lord, today, and we thank you for the Greek sisterhood. We're asking that you put your shield of protection around each and every one of us over our lives as we carry on the business of our sororities and our communities through scholarship, through service, and through other areas that we render activity, activism, and action-oriented activities to. Help us, Lord, in our lives to keep the balance in our work, family, and other extracurricular activities. Father, we also thank you for our guest speaker today. Father, we ask that you bless her in her life and continue to give her all the tools that she needs to be a blessing to those whose lives that she touched. Father, we ask that you continue to get us through our week. Protect us as we travel to and from our work. Protect us as we go to and from our schools and businesses, Father. Father, we just ask that you be with us through these trying times, Father, because we know there's tragedy and calamity all across the land. But Father, we know that you can protect us each and every day. And Father, these is the things that I ask today in your name. Amen.
Amen. Thank you so much, Tangela, for that beautiful prayer. And now I'm going to turn it over to Victoria Taylor, who will deliver the purpose for our event today.
Thank you, Jakari. And thank you guys again for joining us this afternoon. I am Victoria Taylor, a member of Delta Sigma Theta Sorority Incorporated, Carbondale Alumni Chapter. So the purpose of this event is to provide an opportunity for us to celebrate our sisterhood and provide a space for awareness on the important topics pertaining to African American women. This year, we will focus on the mental health of African American women. We hope that this conversation provides an opportunity for us to discuss our well-being in a healthy and safe space.
Thank you, Victoria. We're now going to turn it over to Christina Gordon, who will provide a meditation for today and also a sisterly relations activity. So we ask that you give her your undivided attention as she begins the meditation.
Good afternoon, Sister Source. Christina here. I would welcome you into joining us for our meditation. We're going to practice 3 simple steps: awareness, gathering, and expanding. So if you can, allow yourself to get comfortable as you're seated. Some may place their feet both on the floor flat or keep them crossed, palms on your laps, or like how I have mine like here. Whatever may keep you comfortable and grounded in your current space. For our awareness, the first thing I would welcome you to do is to acknowledge that since the moment is a quick experience, we want to gather and define our posture. So we can sit up straight, stretch your shoulders, loosen them if you may. Define your back in an erect position. Right? You may close your eyes, or if you prefer to keep them open, whichever may welcome a comfortable position. Right. So as you sit in your mind and you're focusing on your current awareness, you're being mindful of the sounds around you, the colors you may see, your current feelings. Are you feeling tension in your stomach? Your shoulders? Are your palms calming at this moment? Mine are, for example. That's okay. But just acknowledging where you are currently and giving grace to your feelings, whether it may be anxiety, whether it may be racing thoughts. And a quick moment to say thank you, God, for breath, for eyesight, for a roof over our heads, healthy family members, healing, a car that's mobile, gas, hopefully the prices go down, just practicing little things to just be grateful for. And what that does within our awareness is bring us in the here and now, not racing our thoughts for tomorrow, days after, duties that are for tomorrow, month after, rent or bills. We just want to focus currently right here, right now. Also, when you're thinking of right here, right now, isn't it a blessing that we're here today safely, gathered together? That's also a blessing in itself. So what we're going to do in the gathering, step out in automatic pilot. In this step, we'll collect from our awareness that we just discussed within grounding ourselves on a single object, the movement of the breath. We're going to gather ourselves, focusing on attention down in the movement of our abdomen. As you notice in your abdomen, it rises of the fall of your breath. Spend a minute to focus on that movement in your stomach wall. Moment by moment, breath by breath, as best as we can, so that when that breathing is moving inward, and you know that that movement is moving outward, you're just binding your awareness to the pattern of the movement in your stomach. This simple activity allows us to gather ourselves using the anchor of our breath to really be in the present. We'll take a moment to reflect on that. In our last step, we'll focus on expanding. This is our third and final step where it allows some extent for our awareness to expand. You're being mindful of your breath, which also includes the sense of your body as a whole. When you allow yourself to become in this spacious awareness, a sense of your body being whole, you'll notice perhaps tightness, holding of the shoulders, your neck, your back, or even your face. When you're noticing these specific things within this current space, you're being mindful of your entire body. Are your toes clenched? Are your legs crossed? Are they simply flat on the ground? Within this simple awareness, gathering and expanding, you're just simply being here in the now, as we are with each other in a sisterly bonding in a simple activity. Thank you so much, Solar Sisters, for joining me in this meditation. It was a simple activity, but I hope that you allowed yourself to just be simple in this here in this moment. Thank you so much for welcoming this activity for meditation.
Thank you, Christina. I'm now going to turn it over to Stacy Saunders, who will bring our Sisterhood poem.
Good afternoon. My dearest sister, may I have a moment to speak to you? Not the mother, not the spouse, nor the cook or the chauffeur, but to you, your essence, your beautiful spirit. Yeah, the strong you, the weak you, the smart you, the overwhelmed you, the sometimes even confused you, the you who needs to be reminded of how wonderful, how ingenious and remarkable you are each and every day that you walk this earth. Take a second, take a deep breath. You don't need anyone's permission to come up for air. Make time. Make time. Make time to rejuvenate, to focus, and to just relax. In this moment, hear my voice and allow these words to permeate your soul. You, my sister, are the image and likeness of a holy God. You are gifted to bring light, love, and peace to a dying world. You are everything that is right, even though you're often blamed for everything that is wrong. What good is a song if the harmonies are not just right? What good is a woman if she's too overstimulated by the worries of others to walk in her call? Your purpose is patiently awaiting you. So this next season in your life, take time to re-energize, because a subpar commitment to God's divine plan for your life just won't do. Let's support, encourage, and depend on each other. In this, we uphold the purpose of sisterhood so true, rendering care and accountability, promoting self-love and endurance, helping each sister to fully live and leave a legacy of success. Thank you.
Thank you, Stacy, for that beautiful poem. And I might add, Sister Sorors and Sorors, that Stacy actually writes these poems that she recites during our luncheons and our forums. So that was beautiful, Stacy. All right, we're going to continue on with the agenda. We do have a special guest and special speaker with us here this afternoon. I'm going to get ready to pin her. So we have Miss Dr. Marquita Bowman, who is a native of the Mississippi Delta. She is a graduate of Ashford University, where she obtained a BA in clinical psychology and went on to receive her master's and doctorate degree in clinical psychology with an emphasis in forensic psychology from the California School of Professional Psychology in San Diego, California. She is currently the Assistant CAPS Director of Counseling and Psychological Services. Dr. Bowman also serves as the liaison for CAPS at the Multicultural Resource Center and co-chair for the Diversity and Inclusivity Committee at the SIUC Student Health Service. She has been in the U.S. Navy for the last 18 years, where she specializes in mental health. Dr. Bowman provides psychotherapy from a cognitive behavioral lens that utilizes other modalities depending on the needs of the clients. Dr. Marquita is an advocate on Southern Illinois University's campus. She is a leader as a Black woman, specifically in the clinical field. So I'm gonna go ahead and turn it over to her. We're so happy to have you, Marquita, with us today, and I'm gonna turn it over to you.
Thank you, Mr. Kari. I wanna say it's a pleasure in being here this afternoon. I also want to thank you so much for reaching out to me to speak to all of the beautiful women on this forum. Like she said, all those things are accurate. I am a clinical psychologist here at Counseling and Psychological Services. And I also am the training director for all of our doctoral interns from their respective universities. And one of the things that I really do love doing is training, but also providing therapy to those who are in need. And one of the things that I love doing is seeing when there is a person that looks like me walk through that door and shares that they need some help and that they would rather talk to someone that promotes representation. And it's not that, you know, other folks here at CAPS cannot do the job, but sometimes when it's your first time talking about things that make you vulnerable, sometimes it helps if you have someone that looks like you. And for that young 18, 19-year-old Black young lady that walks through that door and she sees someone that looks like me, not only am I representing being a Black woman, but an educated Black woman that wants to help that young lady be her best self. So one of the, I know I only have a few minutes, and I do want to respect the time. I want to focus on, the strong Black woman syndrome, which I'm pretty sure a lot of you have heard of, and I'll talk about that in a few minutes. But I wanted to give you, some of the recent statistics that we should know about our community, but also break it down within, our gender. So despite recent efforts to improve mental health services for African Americans, there are still a bunch of barriers, as I'm pretty sure you all know, regarding to access and quality of care. And so some of those barriers are the distrust of the healthcare system, lack of providers from diverse and racial ethnic backgrounds, but also a lack of competency as well as lack of insurance or underinsurance. And so going into that a little bit further is that sometimes we as Black people, and I say we because I have gone to therapy and I do believe in the power of therapy. And as a therapist, I will say that all therapists should be in therapy because we tend to take on a lot of, things from other clients like trauma and a lot of things that go within that. So I'm a big stickler for that. But so I will be referencing as we, and also because I identify as a Black woman. So we as Blacks often receive poor quality of care and lack of access to culturally competent care. And compared to whites or other non-Black identifying people, Blacks are less likely to receive consistent care. There is less frequent research about our population, and Blacks are more likely to be incarcerated than people of other races. And oftentimes, if there is a mental health diagnosis, they tend to overlook that. And I say they by, saying that it's other non-Black folks that tend to reference that, we are just angry people, but it could be a mental health diagnosis. So when talking about Black women, I think that Black women face significant disparities in mental health care. And it's important to understand why these differences occur. I think that it's important to really look at multiple roles that Black women play in society, but also the racial and societal injustices that we have historically faced. I think that's really important. And so some mental health providers, including myself, we believe that Black women are some of the most disadvantaged people in the US, and often simultaneously experiencing racism, sexism, and at times financially inequality. However, on the other side, Black women are one of the most resilient groups around. So with that, one of the diagnosis that I've had the pleasure of working with is trauma. And one of those things that falls under trauma can be postpartum depression. And so I just wanted to mention a little bit about that because I'm a mother, and I'm not for sure if some on this forum are mothers, but I will say that working with some of the Black women that have postpartum depression, they are less likely to accept recommendations and therapy, including medication. So if I ever have a client and they are diagnosed with postpartum depression, we talk about medication and what that looks like. And a lot of them, they don't want it. And the reason being is because the data shows that stigma is not one of the main reasons that Black women do not seek help. Instead, it's the willingness to seek care. It depends on prior experiences of mental health treatment. And so when I share with that, new mom or that second time mom, like, I think that medication will work. Why don't I refer you to a psychiatrist? Like, no, I don't want that, because my first experience with that was horrible. I felt like my needs weren't being met. No one was listening to me, and it didn't make me feel good. And I can understand that. I can understand that. As a little bit of self-disclosure, I too suffered from postpartum depression, and I too felt like I wasn't being heard. But I did my research and found another provider that was tremendously helpful. And it allowed me to see a different perspective, that there are some people out there that are willing to help Black women, but there are a lot of providers out there that do not want to help Black women, just give medication and move on. And so that sets the tone for people who've never been seen by a psychologist or a psychiatrist. So Black women are 1.8 times more likely than Black men to report sadness most or all of the time, and are 2.4 times more likely than Black men to report feelings of hopelessness more or all of the time. However, setting that foundation is so hard for women to transition into therapy. It's not that they don't want to go, it's that fear of that, what happened in therapy the first time or what happened medically the first time will probably happen the second time. And so they tend to opt out. So therapists may also fall into this trap of believing that their Black women clients are strong and resilient, and so they tend to cope better than they are. When I train interns, I tend to look at their videotapes and how they, especially when they are working with someone of color. And so an example would be someone saying, wow, you've been through a lot, but boy, are you strong. And so we talk about those things and how that can be quite insulting to a woman of color, because it's not that we are strong, it's that we really don't have any other choice, whether it's because of cultural reasons or because we don't have anyone else to lean on. So we have to do what we have to do. So even though we have this ability to be strong, that doesn't mean that automatically we want to be. So, it's really important that if there's anyone that is practicing in this in the mental health field, that we really pay attention to how we view our Black women clients. Super important. So, some diagnoses that Black women face typically are depression, anxiety, PTSD, and unfortunately suicide. Not that depression or anxiety is any less important, but a lot of African American women tend to succumb to suicide attempts because of anxiety or depression, and all of these stem from some sort of trauma. So who is going to take care of the caregiver? So who is going to take care of this strong Black woman? So part of the challenge is getting care, right? That unfortunately, there's this belief that people who get mental health care are crazy or weak, and they're the only ones that should be seeing mental health professionals. And so my job is to break that stigma. Other challenges are that we have to be strong and no one can see us hurt. As a Black woman, you are taught to remain stoic. So if you need to cry, go to the bathroom and do it, come out with a really nice face, and pretend that everything is okay. And so you all may have heard of this as the Black woman syndrome or the strong Black woman syndrome or the superwoman schema. And so also, when you look back on your lives as a Black girl growing up, that's when we started to internalize the level of responsibility that people have placed on us. So we have seen this modeled to us by our moms, our grandmothers, our aunties, maybe best friends. It's a cultural expectation. And so I was reading a study from, I believe her name is Dr. Singleton. She did the study at Spelman College and found out that over 158 Black women were they felt like there was a lack of emotional support in the US, meaning I can't go to a therapist because I don't feel like I get support from folks, or I can't even get that social support from my mom because she says, you got to just suck it up and be strong. But the consequence is that strength often means not paying attention to feelings of distress, not paying attention to the impact of familial relationships and race-based trauma and how it impacts our thoughts, feelings, and behaviors. And so other things to consider, I would think, is that we are often judged more so harshly than white women. And our frustration or concerns is basically considered anger. And so that tends to silence us, right? And so women, we should be reminded that attending to our own needs, whether physical or emotional, it doesn't make you weak, right? It makes you better able to care for your loved ones in the long run, should you have to be that person to step up to that. So for those who are wondering, well, what can you do holistically if you're not ready to see a psychologist or a licensed professional counselor or a marriage family therapist? There is no replacement for the help that you can get from a mental health professional, but you can safeguard your own emotional health through self-care practices such as getting good rest, so 7 to 8 hours of sleep, move more, 30 minutes every day, just move, because it helps boost your endorphins and it helps manage some lower level mild depressive symptoms. It's important to eat well. A balanced diet helps you better manage the ups and downs of your day. I think that it's important to connect with a friend, and friends, don't give advice, simply ask, well, what is it that I can do right now for you? So getting a cup of coffee with a friend, a walk. Studies have actually shown that when you have support, a good support system and a good social support system, it improves women's mental well-being. And so meditate. Meditation, such as mindful meditation, helps to improve depression and anxiety. And there was actually a Johns Hopkins study that this group of Black women did an 8-week course, and they found that their depression, anxiety, and pain symptoms decreased. Last but not least, I think it's really important to know your limits. As much as possible, decline requests that may create unnecessary stress, such as hosting parties, planning events if possible, taking a mental health day if you can from work, but also setting boundaries at work, such as not checking emails after you get off work can also help reduce stress. I personally want all of you to be your best selves. Black women's mental health is really important to me. And so we do carry invisible capes. We wear them every day. The problem is that sometimes that cape gets boggled down with barriers and problems and stigmas and issues that we shouldn't have to deal with. So I want all of you to ask yourself, what is something that I can take off of my cape so that as I continue to soar, I can soar with ease. Okay, I do have some resources if y'all need them. I'm more than happy to leave them with Jakari or put them in a chat box if you have that available. And I thank you so much for this opportunity. It doesn't go unacknowledged or unappreciative on my end when people ask me to talk about mental health. And in any way you should need me, any form or fashion that I can be able to be an asset to you beautiful ladies, feel free to let me know. Thank you.
Thank you so much, Dr. Bowman. We really appreciate it. I see a lot of smiling faces. I saw a lot of shaking heads when you were speaking. We do want to open it up and allow questions from the group. We would ask that you raise your virtual hand, or if you're on camera, your real hand. And what will happen is we'll start, I'll select the first person, and then Victoria, and then Tangela, and then Amber. So I do see one hand that's raised thus far, and that is Mickey. So go ahead and unmute Mickey.
Yeah, Dr. Bowman, hi. Good afternoon. Are Black women more likely to get depression or postpartum depression than other groups of women?
Absolutely. So one of the studies showed that, I believe it was 5.8%. There is a 5.8% increase in Black women to get postpartum depression versus those of non-Black identifying ethnicities. So that is correct. The problem is that we believe that rate is higher because a lot of folks do not tend to go in for treatment. And we do know that in African American women as well, that there are, it's 3 times as higher for women to die while giving birth. And so before that, I read a study about those who were concerned about childbirth, experienced depression and anxiety, and did not discuss that because of the stigmas and barriers out there. So yes, Black women do face postpartum depression. I think it's 5.8% higher than those that are not Black.
Okay, thank you.
Absolutely.
All right, Vicki, I'll let you call on the next guest for their question.
All right, our next hand, I do see Monica. If you would like to go ahead and unmute.
Yes, thank you so much for the time. Hello, all my sisters. I just want to not quite have a question, but to just say thank you so much, Dr. Bowman, for coming on and sharing the information and specifically speaking to the certain topics that you raised. I think I agree with you when you say that a lot of our women are wearing our cape. And so a lot of times we just accept having so much on us. And so with that acceptance, we're not seeking the treatment. So I just want to say thank you so much for the commentary. And then also one thing I noted that you mentioned is how you're reading through and reviewing the tapes of how they're actually interacting with that patient. And I think that goes a lot to say who you are as a person and how important this work is for you. So I just wanted to come on and say thank you so much.
Absolutely. Thank you so much. I do believe that, it starts at the bottom. We have to train future clinicians to do the work. And in order for them to do the work, they got to do the research. Not every Black woman is the same. So the expectation will not be the same. And so while I'm here, I'm going to make sure that the clinicians that are training to be future psychologists, that they put in that work, and then they can go on and present what they know to future clinicians as well. So thank you for that.
I know Tangela's probably busy, so Amber, I'm gonna raise my hand. All right, so I'm gonna go ahead and ask a question, Dr. Bowman. In all of the statistics that you provided, and I know a lot of my Black women on here because I know they wear a number of hats, not only in our organizations, but at home, as well as in our professional careers. What are some things that you think are important for mothers who are raising their children to be mindful of as they're, child rearing through the ages when trauma is occurring? How to encourage their kids to talk to them. I know a lot of times, from when you're a kid, you're kind of told by your parent that this is the way that it is, and maybe communication or, being able to effectively communicate how that child is feeling, and maybe even trauma that they're experiencing, to be heard from the mothers or from family members. What are some recommendations that you would recommend for mothers, aunts, daughters to be mindful of as we are having these conversations? Because, let's be real, you and I have had this conversation off screen that a lot of times we pray. We're told, in our community, you go and you pray and you see guidance from, from the Lord to fix whatever issues that you may be having. When in a nutshell, you may have additional issues that may require, counseling or whatever. So what are some things that we can do as Black women to advocate not only for our kids, but those that are around us that we're interacting with when we see some of these red flags?
Absolutely. So one of the things that I want to speak on is child rearing. As a mom, I have a brand new 3-year-old. She turned 3 last Saturday. And so I often think about the way that I was raised, and I question, like, was I getting a whooping? And I say whooping because that's a term we use down south in Mississippi. Like, am I getting a whooping because, well, did I get whoopings because they were angry at me or because I did something wrong? Either way, it didn't feel good. And I'm not here to shame people who do believe in the power of child rearing. You do as you wish, but I question if it is a matter of doing it out of anger or doing it out of discipline. And if so, will that cause trauma as a child grows up? There is no rule book to parenting. I will definitely say that. But I do think that it is important to talk about feelings and emotions with children. When I was growing up, yes, my folks said, give it over to God, pray about it. And as a psychologist, I say this to people when I hear that. Well, sometimes God needs a break too. And that's why he created psychologists. So bring me your problems and give him a break sometimes. I think it's really important to normalize that children do have feelings. Children can be sad. It's funny that when a baby cries, we tend to the baby, we nurture the baby. When the baby learns how to walk and the baby falls for the first time, we run to the baby, oh, you have a boo-boo. But when the baby becomes 5, 6, 7, and they're crying, it goes from what are you crying about? You have nothing to cry about. When they're 15, you have everything you need. You shouldn't be depressed. There's no need to be depressed. But we should be asking is, what's causing the tears? Talk to me. Are you sad? What does sadness look like? If a child says, I'm depressed, well, first of all, what do you know about depression? What does that look like to you? What does that feel like to you? You can tell mama anything, or you can tell your school counselor anything, because we want to make sure that you can be your best self, right? And so when we don't have these conversations at an early age, what typically happens is that kids will grow up with interpersonal relationship concerns. They don't know how to deal with their anger. They may not know how to deal with their anger. Let me say that. They may not know how to deal with frustration or sadness or depression. So they utilize other modalities to lessen the pain, which goes into a whole nother field, talking about substance use. So finding ways to suppress these emotions because they don't know how to deal with them, that creates a lot of struggle for them. So as a parent, I think it's really important to start talking to children. And also, I would recommend family therapy. If your child is having difficulties talking to you, maybe sharing, well, I would be more than happy to go with you to talk to someone because I care about you. And it's okay to have these emotions. And so we have to get away from saying, oh, she's just being an emotional teenager right now, or they're just emotional right now, they're just mad. But finding out, well, maybe they don't know how to express themselves and talk about these things. And that's why they lash out through anger or sadness or depression. So normalizing that everything that children go through developmentally is normal, but we as parents are here and that mental health is real and it's okay to get mental health treatment.
Thank you so much, Dr. Bowman. Are there other questions from the group? Sister Soares, this is the time to get them answered.
I have a question. This is Stephanie Esther. Can you hear me?
Yes, Stephanie.
So it's kind of like a thought theory question, but I sometimes think that this super Black woman makes us, the super Black woman theory makes us hard and not vulnerable. And have you ever done any studies or research that looks at what we need to do to reclaim that vulnerability that, and I'm going to equate it with femininity, and I hope I don't like cross a lot of bars and fields and landmines, but I'm looking at that superwoman complex that removes a layer of femininity from some Black women, because we're so busy being so super and so hard, and we're not vulnerable. And maybe the question is, who can we be vulnerable with? But have you done any research? Do you have any theories about how to restore that and relax in that? And, nobody has our back, or how do we, just I'm kind of think talking the question, but I think a bit. So
I'm following. Thank you.
Okay.
I haven't necessarily done any research, but I will say that a lot of the clients that I do work with are from ages 19 to 28. And some of them are young mothers, some of them are graduate students, and some of them often come in with mother-daughter concerns. And they often talk about how they feel like they have to put on this face that everything is okay and that they have to be strong, that all they have is themselves or their moms, and that their moms sacrificed a lot for them to be here, and that their moms are very independent or mean, or that's why my mother never married, because no man wants to deal with someone so strong like that. And so one of the things that, as I listen to these young women talk about these things, they all have something in common. They all cry as they talk about it. That's where they're most vulnerable. And I tend to talk about that piece. Like, well, what is it like to be vulnerable? They often share that they don't know. And so I say, well, in this moment, how do you feel? Do you feel vulnerable as you talk about these things that you feel like you can't talk to anybody about? And they often say yes. And that vulnerability in the room is the strongest characteristic a woman can ever have. That even through your strongest moments, it is okay to be vulnerable. And one way to do that is to say, listen, I may be strong, but I'm not strong all the time. And it's okay. It's okay to throw my hands up. It's okay to say I'm tired. It doesn't define who I am as a person. It defines who I am as a human being. It doesn't define me as a woman. I'm a human being. You know, I often share that I can relate to someone who, I mean, me personally, I think I'm a type A woman. I'm a go-getter, I'm strong. But there's been times where I've had to sit after a session with my client and cry it out because I didn't feel like I gave my best. But then also, it's not about me. It's about them being vulnerable and sharing with me and saying that I don't have it all together. And me sharing with them that you don't have to have it all together. Because whether you have it together or not, guess what? You still got a cape. But it's up to you to start talking and communicating about the things that you want to let go of because you have no control over it in order for your flight to be lighter. So start thinking about the baggage that you carry, that you hold on to, that's dragging you down, and start dissecting, well, what do I need to do to take that stuff out of my bag so that I can move forward and my load is lighter? So communication is key, and owning that even the strongest woman can be vulnerable, and being vulnerable in itself is being a strong woman. That's a strong characteristic to have. But I can find some research, and I can also email that to you if you like as well.
Thank you, Dr. Bowman. Taking any questions. I do have a quick question. If you can speak to the embedded thread of social media in our society, how it has turned into another method of trying to feed the external validation. Not just younger people, I think it's more intense with them. But I mean, just looking on TikTok and seeing how many grown men are very thirsty, and meaning those that may not know what thirst trap, or trying to get likes, if you will. So to see that it transcends age, that people are using social media for quote unquote fame, external validation, and how that impacts, you know, your what you're seeing that is impacting the mental health.
Absolutely. So, you know, social media, I think, has definitely given a lot of false hope to, I think, society in general. I think that folks who tend to do the not all, but some folks that do the TikToks and the Instagram things for the likes, I often think that there is a correlation between the many likes that I get, the more I'm accepted, finally. And I say finally because there's a disconnect between them liking who they truly are, expectations of what we would consider societal norms, but also I think because they lack interpersonal competency with face-to-face folks. So not being able to be their true selves. And so when we have, I would say, in the closet social phobia or social anxiety, we can use social media because it creates an unrealistic expectation of who we tend to be. An example, I remember when one of my good friends just had given birth to twins, and I often talked about how beautiful her skin and her bone structure is. Like, she has like the best bone structure to me. And so one of the things that she would do is she would try to filter her face, because as we know, sometimes when we are pregnant, we get, hyperactive acne. And I shared, like, why do you need to do that? Like, well, because I want people to continue to like the face that they used to see. And I'm like, oh, but you're not being your true authentic self in the now. So I think that it goes back to, if people like me, the more likes I get, the more I will like myself. And that's not realistic. It's not realistic at all. And I think that, people who tend to watch these things are often feeling left to believe that, wow, in order for me to, have people who are interested in me, or I have to look a certain way. I have to watch this stuff on social media, because that's the expectation, and that's the new societal norm, when it's not realistic. So I do think that there is, when I see these things on social media, I do think it is because of past personal issues, and also current interpersonal incompetencies with people in society in general. So therefore, they tend to do things on social media to fulfill that void, versus talking to someone about how they truly feel about themselves.
Thank you. Are there any more questions?
I do believe I saw a hand raised from Kim. Do you still have a question?
I do. Thank you, Victoria. Dr. Bowman, thank you for being with us today. I have a question with regard to sort of, trauma.
Mm-hmm.
So this has been a really traumatic time for all of us living through the pandemic and suffering so much loss during this time. And I guess for me, so I'm just going to be transparent and open. So for me, it's sort of gotten to the point to where even now, because it's continuing now, that I have family that's continuing to pass away. And then I have friends who are losing their spouses and losing children. And it's just like been ongoing, like just nonstop, 2 or 3 times a week. This is the message that you keep getting. And then you have to keep being there for people. And not to say that you shouldn't, you love people, so you want to be there for them. But just being able to give yourself permission to sort of stand down in some ways and be there for them in different ways, because continuing to essentially go through the ritual and sit with people and be with people, it can be traumatizing for you. It doesn't even have to be your loved one. A classmate of mine lost his mom last week, and I just really, really sad for them, because they have a large family and they're a beautiful family, and we've been together since high school. But I just could not do it. I couldn't go and be there, because it was just, I just felt like this is some trauma. This is the impacts of trauma, of having to do this so much and having to be so intentional with this for so long, for an extended period of time. This is not normal. What we're going through right now, this is not normal. People don't tend to pass away, at the rate that they're doing so now. And it's happening to close friends, to associates, people that we work with. It's just continuing to be all around us. And so I guess my question is, how then do we sort of work with that?
Mm-hmm. Well, first of all, let me say that my heart goes out to you and to those around you that have suffered traumatic losses, unfortunately, to the pandemic and any other ailments during this time. It sounds like there's some burnout there. It sounds like there's burnout, feeling crispy, toasty, however you want to call it. That's what it is. And what I'm also hearing are, and I'm not here to diagnose, but what I'm also hearing is traits of complex PTSD. So, which is complex trauma. And basically what that is it's caused by long-lasting trauma that continues to repeat itself for basically months or years. And so it seems like for these past couple of months to and we've been in the pandemic since 2020, so I would say years, and that's why I related it to some complex trauma. And also with that, we've also dealt with some race-based trauma when we heard the verdict of Breonna Taylor and heard the verdict on George Floyd. How do we deal with all of these things? One of the hardest things that I think people don't do is set boundaries and limitations. And it's because we don't want to hurt others' feelings. We would rather put other people's feelings and concerns before our own, but that is what causes caregiver burnout. And so one of the things that I would recommend is that you set boundaries, but also say or ask, well, although I cannot do everything and be everywhere for everyone in this moment, what can I do right now? Because you have to set some time for you too. I'm pretty sure that everyone else isn't grieving the loss, but you're also grieving the loss too. You have to take time to grieve as well. It's time out for suppressing feelings and putting them to the side or compartmentalizing, which is a fancy way of saying putting things in the back of our head and dealing with it for a later day. You have to learn how to set those boundaries. I love you and I care for you. I need some time, but I will get back to you. And also, find time to talk to someone that you feel closest to and be vulnerable. Let it go, let it out. Because the moment because if you continue to keep feeling burnout and holding on to things and doing everything for everyone else, then it becomes a physical or a somatic concern. So we're talking about hypertension. We're talking about stress. I'm talking about heart disease. I'm talking about diabetes. I'm talking about overeating. I'm talking about having what we would call it down south, a nervous breakdown. We're strong, but we can't do it all. So I say to you, set realistic boundaries for yourself so that you don't continue to have burnout. Yes, I'm finding that we have to keep an eye on our charts. Yes, you have to know who puts what in your record. That is so important. I'm a big stickler of whenever you go to the doctor, make sure you get a printout. Make sure you get a copy. But to go back to your question, make sure you set boundaries for yourself. Boundaries are healthy and they're not to be mean. They are there to protect you from caregiver burnout or burnout in general. And also it allows you time to grieve yourself. Go through the stages of grief, do what you need to do so that you can be refreshed and so that you can go back in and continue to be a great caregiver for those who I'm sure need you, because obviously folks wouldn't come to you if you weren't a person that knew what to do in the time that was needed. You always, I'm sure that we always tend to find a way to just make a way, but also make a way for yourself, because your mental health matters too. Okay.
Thank you, Dr. Bowman.
You're welcome.
Thank you. I believe we have time for one more question. And I believe Sierra, is your hand still raised?
Sarah.
Yes, I'm
Yeah.
sorry, but I saw
No.
Dr. Weaver's hand was up before mine, if that's still appropriate. Well, I'll just go ahead since this is the last question. Thank you so much, Dr. Bowman. This has been so super helpful, and I hope that you realize that today, I know everybody has a heart just like mine, and we're so thankful and appreciative that you've done this. Definitely, for me, I've had some postpartum depression, like so today I'm probably gonna get off here and just I have to have a moment, and maybe somebody else might need to hear that I'm gonna have a moment, so it's okay for you to have a moment. But mentioning that it's kind of hard trying to find providers, especially trying to find a provider that might look like you, because of the stigma behind taking drugs and things like that. So for me, I've done therapy. I love it. I had a great therapist, but just I feel like at some point it may be time to move on. So I'm transitioning. So at this time, what I'm asking is, do you have any books that you recommend, any authors, any podcasts that you're listening to? I know we had there was like a mental health CPR certification that was going around. I couldn't attend it at the time, but I thought that was a wonderful thing that the community might need, because sometimes when you're struggling and you get this person doesn't have appointments and for the next 3 months, or you need to talk to somebody right now, but it's just not happening. And that can sometimes, for me, it's a deeper trigger, like, oh my God, I'm never going to get help, so are there any resources that you might be able to like kind of leave us with, or something that we can continue to have these moments with ourselves to help?
Absolutely. I do have some sites that I want to give y'all, and can I put those in the little chat
You go
thing?
right ahead, Dr. Bowman.
Okay, I'm trying to figure out how to do this, so y'all just bear with me, because I don't really. Okay, how do I get them there? Because I do have some.
Copy and paste them, and then just click in the chat box and then paste them in the chat box.
Okay. I'm trying to, let me see here. So, I'm trying to make my screen bigger, y'all. I'm so sorry. So that I can do that. Standard. Okay, how about this? I can't get to the chat box. So is it possible if, oh, wait, nope. Oh, here it is. I see it. Okay, paste. So I just put all of those in there for your viewing pleasure. These are the top sites that I love, because they tend to focus on the Black woman. There are some, I think, that do focus on Black men healthcare, mental health care, but primarily it's for women of color. And there you'll find podcasts and books, I believe, as well. One of my favorites is the Melanin and Mental Health one, and Therapy for Black Girls, where you can find therapists in your area, things like that. So and then I do have a book that I downloaded recently. I will send that link over to Miss Jakari so that she can share that with you beautiful women as well. You may have already read it, maybe not, but I will get that link over to her so that she can share it with y'all. It is a free download, and it talks about women and dealing with our mental health. So hopefully that'll be helpful to all of you.
Well, I just want to take the time to thank you on behalf of the group, Dr. Bowman. This has been amazing. I think it has really kind of uplifted some of our spirits. I know it's been a lot that's been going on in the world and our personal lives. And again, like you said, just being real with yourself in that moment. This has been very beneficial, like I said, and just giving folks what they need today. Just giving us a little bit of that push to, make sure that we are taking care of ourselves and being vulnerable and, taking the resources that we need to be an asset and an advocate for ourselves as well as those that are in our lives. So thank you so much. We really appreciate everything that you have done for the group. And we want to bid you farewell. We do have a gift that will be coming to you on behalf of all of the 4 organizations for, blessing us with your time and your expertise, just in dealing with Black mental health, especially with females. So we thank you so much. We hope you enjoy the rest of your Sunday evening. We look forward to working and partnering with you in the future. Give her a round of applause, Soares and Sister Soares.
Thank you so much. And Jakari, whenever you need me, I'm here. And please, I wish y'all nothing but the best. And please note that whatever you're feeling, listen to yourselves. It's normal. Don't be ashamed of it. And lean on your sisters for encouragement. And God bless you. Thank you so much for having me.
Thank you, Dr. Bowman. Have a good one.
You too. Bye-bye.
All right, Sister Soares, we are going to take a group picture. So I'm going to stop sharing. We are nearing the end of our session. So I'm going to put it on a full screen so that we can take a picture. If you have your camera on, that'd be great. If you could turn it on, you got a cute picture. Whatever you have will work, but we're going to take a couple pictures so that we have it for the books and for our records. So on a count of 3, I am going to take about 3 pictures because I have I think I have 2 screens up. So we'll take a couple pictures. So count of 3. 1, 2, 3. All right, I'm going to the second page. Keep smiling. All right, 1, 2, 3. All right, thank you all so much. We do have, I'm going to get back to the agenda so we can get us moving forward. I am going to have the conclusion to be brought by Mrs. Amber Suggs.
Thank you so much. It's so wonderful that we were able to come together, even if it is virtually, today with our sisterhood as we service the Southern Illinois area. I just want to leave a couple of thoughts with you. First thing, nobody can sneak in the earth. So that means every one of you were selected to be here. And we all have an expiration date, which that can't be negotiated. And one thing, a meme that's passing around quite often is that Kobe Bryant made a statement that one of the mistakes that we make is thinking that we have time. In thinking in the context of time, there is a professional basketball player from the Phoenix Suns. His name is Bismack Biyombo, if I'm saying it correctly. And recently, he's taken his whole year's salary to build a hospital in honor of his father over in his native country on the continent of Africa. He said the thing is to not live forever, but to have something or to build something or to plant something that does live forever. So to tie all of that together, each one of you were given a service to implement and to leave this legacy that lives forever. But in the process of it, you have to show up. You have to be healthy to continue to be usable. So through this process, please remember to take care of yourself first, and that to always believe that you matter. Because when you can always walk in the vein of understanding that you matter, you will continue to be a servant, to be a blessing to everyone that crosses your path. And you will be leaving something that lives forever. Thank you.
Thank you so much, Amber. Sister Soares and Soares, I'm going to launch a poll. If you could please take a few moments to complete that. While you're doing so, I have a little flashback from the past. I don't know about y'all sorors, sister sorors, but I am looking forward to when we can actually get back in person and do our luncheon. We had such a great time. So we just have a little flashback of some pictures from when we were in person, as well as when we were virtual. So you may see yourself in some of those pictures. This is our joint table that we did, which was really fun and really cute. And then obviously last year, because of the pandemic, we were virtual. So we thought it would be a nice touch to add some of our virtual pictures. We find a way to get it done, sister sorors and sorors, whether it's virtual or in person. And so just stressing that Greek sisterhood does matter. You all matter. We matter individually. And again, like I said, we want to just thank you all for attending. We hope you guys had a great time. Again, put yourselves first. Seek help when you need it. But again, if you all could too also complete the survey, that would be great. That'll let us know specifically how well you all enjoyed this event. We thank you all for coming today. And we hope you all had a great time. If there's nothing else, Sister sorors, take care. Have a great day. Shout out to our committee.
Where is the survey? Where is the survey? I don't see it.
It should be in the poll, Mickey.
It should be where?
It's in the poll. It's launched.
Oh, okay.
Okay. I do want to give a special shout out to the committee, Victoria from Delta Sigma Theta, Tangela Oliver from Zeta Phi Beta Sorority, Amber Suggs, as well as Mrs. Mayberry from Sigma Gamma Rho, for really just keeping this initiative going. It's been hard with us being virtual, just to get things, continuous to move, but this is something that we've made a commitment to. All 4 organizations that we want to make sure that we continue to have throughout the years. Hopefully in the near future, we'll be able to get our fraternities involved with the luncheon to get us all together. But again, I want to especially thank them because we've been meeting for the last couple months virtual, just really trying to get something together that we thought would be beneficial and rewarding to you all. We all know we wear capes, that we have a number of different roles and responsibilities, and we wanted to make sure that we were pouring something back into you all. So again, thank you all. We hope you had a great evening and we wish you well. Thank you.
Corey, I'm trying to find the poll. For some reason, I cannot find it.
It looks like you might have already completed it, Mickey, because it say 38 at 38. So I think you might have already done it.
Well, I don't remember doing a poll, but okay.
Yeah, I see 38. It says 38 people have done it. I know the people who are on the committee can't complete it if they're co-hosts. So what I'll do too, Mickey, I'll go through and I'll just try to send you the questions and you can complete it through email.
Thank you.
No problem.
Great.
Thank you, Mickey. Hey, Vic.